Thank you so much for joining me on the show. We'll take you quickly now to the Information Ministry. We have some briefing on Ghana's fight against COVID-19.
Address, where you live, where you have been before coming, and also tell us whether you have any symptoms or no. This is online. You can get the link and fill either online or before you board or when you arrive. But when you are not able to do that, we provide electronic tablets for you to key in this information, which electronically transmitted to the Port Health as you get there. And that gives us all the information about you and about the patient, including your passport numbers. Step 3 for the test is to go and make payment at the bank, and you have, if you don't have a card, you have ATM to cash money and pay, among other things. Here are moving into where the sample booths are. You go into the 35 cubicles where samples are taken, and as you can see, that's where you enter, and the lab man is there to take your sample, which takes about a minute or less. So this is an example of how someone's sample is being taken, and this is how the lab people who are taking the samples are protected in their full PPE gowns up. So the samples are taken to the lab. Taken to the lab, and this is the machine that does the sample. It's an immunoassay fluorescent test that does the antigen test with a very high sensitivity, over 99% sensitivity and specificity, which means that if it says you are negative, you are really negative. If it says you are positive, it's really positive. And after that, you come down to Port Health. This is the new Port Health booth where your temperatures are taken, and the Port Health people will screen you, validate your pre-arrival PCR, and then your test results will have been there for them to complete. And then if you are negative, you are cleared to go to the immigration and continue the process of getting your bags and going home. If you are positive, you'll be assisted by Port Health into a holding room where you'll be processed, you'll be clinical assessed. We have clinical psychologists there for those who may need support and then you are moved into the Ghanese for further assessment. So the next slide shows you next slide shows you where, and the next slide, this is the holding area where people will wait and be processed and taken to the Ghanese for further assessment and then management. So thank you very much, Honourable Minister. This is what we have.
Thank you very much, Dr. Patrick Umabwaji, the Director General at the Ghana Health Services. We are still awaiting the arrival of the man coordinating our testing regime, Professor William Ampufu of the Noguchi Memorial Institute, to join us. I think that in the meantime, we can remind ourselves that in his 16th address, His Excellency the President admonished the country not to lose guard since we were not yet out of the woods. He also called on us to continue to observe the COVID protocols. And so we want to once again appeal to our friends in the media to continue to pay attention and also dedicate some time to COVID. We know that the political temperature is rising, but we hope that we can find a fine balance and sufficient space for COVID education. It is critical, and this is an appeal to our colleagues in the media. We must continue to view this as a national exercise and pay the necessary attention. And so may I, at this juncture, admit questions that are relative to Dr. Abwaji's brief as we await the arrival of Professor Ampufu. So we'll take questions now and we shall proceed. Questions for the good doctor, please. Let us get the mic ready. Okay, we can go on.
Thank
your
you.
name, your media.
My name is Cliff Ekufu. I write for the Ghanaian Times. Good morning, Dr. Kumar-Boakye. Doc, following the announcement for the fees for the testing for those arriving from outside, the amount of $150, there has been some level of uproar. People have complained against the amount. I would want to find out what government is likely to do about it, and if the amount is reasonable for us as a country. Yeah.
Good morning. My name is Blessed. I work with Class 91.3 FM. Honorable, I have a question directly for you. At the early stages of the COVID-19 pandemic, the Ghana Food and Drugs Authority disclosed to the nation that they have not approved any RDT test, which is the rapid diagnostic test. They've not approved any of the kits. And according to the FDA, their decision was guided by current global practices and advice from eminent Ghanaian scientists. However, following the reopening of the Kotoka International Airport, it appears that the results that are coming in in just the speed of a minute, as we are being told by the authorities. So the device being used for the testing, do we have clearance or probably approval from the FDA, and what's the FDA's position on this? Thank you.
Yeah, good morning, Honorable Minister. And Dr. Abuaji, along the line, when we're fighting the COVID, the general complaint from some health facilities was that they don't have enough PPEs and some testing kits and things like that. What is the position now? Because
can you take the question again?
In the heat of the COVID, some health facilities were complaining of insufficient or lack of PPEs and some testing kits and things like that. So we want to know whether the situation has improved, or because the rate is coming down, we can just do with what we have now. You get me now?
All right.
My name is Nanapoku from Daily Searchlight.
We will take the last two sets of questions, and then we'll go back to it. So your name?
My name is Komla Adom. I work with TV3 and 3FM. Dr. Kumar-Boakye, on the first day of the reopening of the borders, or the air borders, I saw you and your people at the airport. I imagine you would have been doing an assessment and observation of how the process had been going that day. I want to know how many people have been successfully tested at the airport on the first day, yesterday, the second day. At the time I spoke to one of the port health officials at about 4 p.m., he said they had only tested 30 individuals. I wonder if the process so far is smooth, because we know there are challenges. We've been told also that we will be given access to see the devices that are being used and how the processes have been unfolding. We were told that on Monday at the press conference. Today is Thursday. We still have not been given that access. I want to know exactly if there's any plan for us to be able to observe these processes so we can inform our audiences accordingly. And also the time you speak about, that between 10 and 15 minutes, averagely, the tests could be done. We spoke to some people who had arrived, and they said they spent more than 30 minutes to have their test done. What is accounting for this? Thank you.
Abednego.
Yeah, Honorable. Good morning. Honorable, you're from Abednego Asante Sedu. We are Juma Wadom FM. Follow up to colleague Nibisa, and then person me find out and they say, out of numbers now so far, arrivals now my text, you know, more positive case, and I'm sending you negative. Thank you.
Thank you very much. A few questions. Doctor, one relates to the cost of the tests. There's another question about the PPEs. I don't recall the last time I had any issues and complaints about PPEs, but if there are any that have come to your attention, how are we addressing those? A colleague wanted to find out the numbers that have been tested so far within the 2 days that the airport has been operational, somebody also wants, the same gentleman wants to understand how smooth the process is, and if indeed we are operating within the time. Do we have any positive cases? There's one case, there's one question on the FDA. I will defer to doctor on that, but I will take a quick bite at it and I'll let doctor handle it. And I think that I want to refer you to the statement issued by the Food and Drugs Authority on the 1st of September 2020. Please avert your minds to that statement. And for the benefit of our viewing public, I'd like to read portions of the statement. And I read paragraph 2. The FDA wishes to state that testing authorized for detection of the SARS-CoV-2 virus at KIA is not a rapid diagnostic test kit, but rather a device which detects the virus in nasal swabs. Again, there's another paragraph that says that the device detects antigen by fluorescence technology, and that it is worth noting that other matured regulatory authorities like the Ghana Food and Drugs Authority have approved this technology and similar products for use in detecting SARS-CoV-2 virus. And so please, I invite colleagues to avert their minds to the FDA statement of 1st September 2020. I shall yield to Professor Dr. Kumar Boaji to take the other questions and also to address the FDA issue.
Yeah, thank you very much. I think some of the questions are linked, so I'll try and go through them. First is about the cost. Generally, what do we want to achieve? We want to achieve a test that is very, very sensitive, that tells you that if you are positive, you are positive. If you are negative, you are negative at the shortest possible time. And to look at that, what you get, the new technology that provides that at a cost. But let me explain to you that where people are using PCR and they are charging, I hear Egypt is $30, some are $75, you need to go to your hotel for a day or two to wait for your results. And so you have to put all that in the cost. And for someone, a new equipment like that, you expect that the cost build-up is not going to be easy. But even in that, you realize that it's still relatively cheap. I'll give you an example. Someone wants to know how many people were tested on the first day. We had about 217 or so from 3 flights that came in. There was a group that had even given me a letter requesting that asked for them, they have booked for quarantine, they want to go into quarantine. But when they got there, we realized that a significant number of them had done their PCR on arrival. They opted to wait and go back and do the lab, the antigen test, or the virus, which is still a virus test, so that they can go home. Because you can look at the cost benefit. That is really not as exorbitant. So that, and we've also not had any significant protest from anybody who feels that the cost is expensive. So the cost is more about the value of what we are providing at top speed and high quality, sensitive result that gives you what we all expect. Because the ultimate goal for the country is to ensure that we don't import any new virus into that. All our problems started because everything that came here was imported, and it gave us a lot of problems. So that is what it is. I'm sure the airport authority will be organizing an opportunity for media to have a look at the place. It's a beautiful place. I'm sure people see the pictures and they wonder whether this is still the country they know. So I'm sure you'll be given opportunity to go and have a look. What time, how long does it take? If you ask a passenger, he's talking about when he got down to when he got out. You fill your declaration form, you go and pay, go and do the test. The test itself takes, once the sample is put in the machine, it takes maximum 12 minutes. But you need to talk about that, including going for your results. And so those who said they spend 30 minutes, that's very, very short, I can assure you, because they have several steps that you have to go through, including going through Port Health to get clear, go to check your this and make sure that you are negative and you can go. So far, we've not recorded any positive case, and that is what our ultimate aim is to. We are not here to catch positive people. Our ultimate aim is to ensure that people arrive here negative and truly negative. So that's why you do your pre-arrival test, and then when you get there, we confirm with another test to make sure, because of the people can be maybe incubating and they could change even in transit, whatever. So that's why we look at that. And even then, they are spoken to that when you go back, follow up the protocols and ensure that you do not, and even if you were to develop it later, you report appropriately for care. So, so far, no positive cases have been found. PPE, I'm sure PPE is a sensitive matter that if it was really, there's a shortage, you'll be the one telling us. So far, I think our PPE supplies are adequate and we are able to, on top of the game. We started with a problem, it was a global shortage. We ramped up our system, both importation and local production. So far, we have enough PPEs, including the one that you're also wearing. Thank you. Honorable Minister, so I think that's covered almost all. Professor Ampofu is here, so we talk about the RDT, that what we are doing is not an RDT, but Prof will be the one to talk to.
Total numbers that have been tested.
The first day was 217. I think yesterday there was about. Yesterday there were 30. It depends on the number of flights that arrive. The first day we had 3 flights: KLM, a group from, and then we have the TAP Tortuga. So those are 3 that gave us the number.
Yeah, but colleagues, we must understand that the Director General is not stationed at the airport. The Ghana airport will be available to give us the details. I mean, definitively.
Yeah.
But we can. He has given us a rough idea, and that is a good.
On for the first day, we were all there to observe.
That's right.
How the system operated. So we were there till about late in the night before we left.
That's right. So on the first day he was there, and that's why he can report on authority on the first day. But the subsequent days, I'm sure that we can always give you the figures after we have checked. Thank you very much, the Director General. On Tuesday, the 1st of September 2020, flight operations resumed at the Kotoka International Airport under some strict and carefully thought out conditions. One of the requirements for passengers arriving at the airport was to undergo a COVID-19 test, which result would be made available almost immediately. There have been some concerns and debates, some of which have been raised here and answered. But the gentleman in charge of coordinating Ghana's testing regime, like I indicated to you, Professor William Ampofu, is here. We'd like to invite him to also address some of these issues that border on what kind of test we are conducting at the airport, what issues about the specificity and sensitivity. It's a mouthful, eh? Specificity and sensitivity of the test that we are conducting. The questions about whether it was an RDT had been asked, and I had to refer to a statement issued by the FDA, but the man himself is here. Prof, please take the podium and speak to the issues of our testing regime at the airport.
Thank you, Minister. Apologies, I had a few transport issues. The test at the airport is an antigen assay. It's based on what we call a fluorescent immunoassay. It's a point-of-care device. It takes 6 samples, which take about 15 minutes to come out. The sample that is taking is a nasopharyngeal swab. Now, as you heard from the FDA, this device and its reagents were assessed by the FDA. And on behalf of the COVID task force, I carried out an assessment of this device using samples that we had tested by PCR. So this device uses fresh nasopharyngeal samples. So we also conducted at 2 of our treatment centers another assessment using fresh samples. In conclusion, we found that the device is 100% specific. That is, when we look at samples that are declared as negative by PCR, these samples were also found to be negative for antigen presence for COVID-19. When we looked at sensitivity, the ability to pick up samples that were positive by PCR, the machine gave us a range between 90 to 95%. Now, this we deem to be satisfactory because the policy for the airport is that passengers who are arriving are supposed to have a negative PCR. So we expect that when we do the antigen at the airport, because it is 100% specific, we expect to find that there will be nobody coming in with a positive result. That is the basis for recommending the use of this antigen machine at the airport. Because it is faster than the PCR, that's why it has been referred to erroneously as a rapid device. The PCR takes about an hour and 30 minutes, 2 hours, when you load a sample into the machine. It's impossible to do PCR at any airport and get a result within less than 3 hours. That's why I think most of the data that you have for other airports is talking about sample taking and then the results made available later. With regards to the cost, I think it's very, very, very difficult to sit and estimate the cost. The cost of a test in a hospital, in a lab, is totally different from a cost that is offered as a service by a private provider in circumstances where he's expected to process. If you take a flight that has 300 people, you expect him to process them within 15, 20, 30 minutes. This means setting up multiple stations, multiple testing stations, having several staff in place. So the cost per test is not a cost of a reagent. If you take even the cost of the machines, let's take PCR. One PCR machine is about $50,000. In order to do the processing before you do the PCR, you can come up with an automatic RNA extraction machine that's about $40,000. Already you're looking at $100,000. Okay? If you're just looking at the machine setup just for PCR. So if you try to put that in multiples, okay, at an airport, you have at least 10 of them. So you multiply that by 100,000, you're already looking at $1 million. Okay? So I'm giving you an analogy between trying to set up a testing system to detect the virus itself and then using a faster method with the latest technology at a more reasonable price. So that's the system that we have in place. I hope I have been able to explain the issue. And we found that the specimens that we take, I mean, your result coming out as negative or positive depends on the quality of the sample that is taken. So we are going to provide oversight from the national network. We're going to examine how the operations at the airport are done. We will be looking at how the staff have been trained. We'll look at how they operate. We'll look at their operating protocols. And together with the Ghana Health Service, we ensure that, we have a very efficient system at the airport. All this is based on the fact that the passenger will be traveling with a negative PCR. So it's very necessary, as the DG has explained, to ascertain that the person is truly negative so that we minimize the risk of incoming infections into Ghana. Thank you.
Thank you very much, Prof. Prof, we shall take some questions for you after I invite back to take the podium the Director General of the Ghana Health Service. You recall, gentlemen and ladies, that our brothers and sisters are in school writing their WASI exams. We are advised that by end of week, the examinations would have come to an end. I'd like for the Director General to advise the nation on where we stand and what is the way forward relative to our brothers who are in school. Some have described them as the Akufo-Addo graduates.
Thank you very much, Honorable Minister. By Friday, the WASI will be over, and we are happy that they've been able to successfully go through the exams and without any major disruption. We are expecting that any school that did not experience any case, they can vacate and they all go home. Secondly, any school that has not reported any positive case in the last 2 weeks prior to the closure can also all go home. However, if there's any school where they reported any positive case, we will do some assessment of contacts and those contacts will have their vacation delayed assessed before they go home. Just like we did earlier, we had announced earlier. So basically, that is what we're saying. We are very happy, and we're also urging them that when they go back, they should serve as worthy ambassadors. They've seen how adhering to the protocols can actually protect you from getting the virus, even in a place where they are all working in groups and taking exams. So we want to use the opportunity to thank everybody for their support during that period, and that apply that those students will be coming home by Friday. Thank you very much.
Thank you very much, colleagues. Just to underscore, the schools that have not tested positive, and there are several of them that have not tested positive, they are free to close and go home. There are schools that have not had any positive cases within the last 2 weeks, and so they may have had some positive at the very beginning, and there are a few schools that may have had some positive at the very beginning, but within the last few weeks they haven't. The last 2 weeks they have not. They can also close. But any school that has recorded any case within the 2 weeks before the vacation date, they will do contact tracing, and those who have been reasonably suspected, the extension, there will be some extension of them staying on campus. And we want to thank the team that has been working to keep our children, our brothers and sisters safe, even as they write their examinations. We understand that they had to do that because we didn't want to use COVID as an excuse to truncate and frustrate the future of the children of Ghana. I will take a third matter, and then we shall take questions both to the issue that has now been addressed and to the issue of the testing that we are doing at the Kotoka International Airport. Government, through the Ministry of Finance, engaged with civil society players and other stakeholders yesterday over government's intent to activate relevant portions of the Minerals Income Investment Fund Act 2018 as amended. This engagement was born out of government's desire to provide clarity and information so as to disabuse the minds of anybody who may have been misled to suspect wrongdoing, and also to carry the country along with it as it embarks on this exciting and novel journey of adding value to our natural resources and in keeping with the Ghana Beyond Aid agenda. We are happy to continue to engage and provide clarity to anybody or any institutions and organizations that may so desire. In the meantime, even as we engage, government shall continue to work in the best interest of the Ghanaian people, use our nation's resource to leverage our assets for tomorrow. Let's be reassured that the income from the Ejapa Mineral Royalty Limited arrangement would be used in 4 main areas, namely health, education, road infrastructure, and housing. Ladies and gentlemen, government continues to keep its eyes on the ball. I thank you. So we shall now take questions for Professor William Ampofo and Dr. Kuma Abuaji, Director General of the Ghana Health Service. Any quick questions, please?
Thank you. Yeah, my name is Maxwell Abobo. I work for JoyNews. My question goes to the Director General of the Ghana Health Service. The Bureau of Public Safety has released a statement, and they are saying that the mandatory testing of persons at Ghana's airport is in contravention of international health regulations. And they specifically stated, I want to read that to you, Part 7 of the International Health Regulations 2005, and it says that except for travelers seeking temporary or permanent residence, no charge shall be made by a state party for any medical examination provided for in the IHR or any supplementary examination which may be required by that state party to ascertain the health status of the traveler, examined for the protection of public health. I think this is a good platform for the Director General to respond to that statement, whether the mandatory testing of persons at the airports is in contravention of international health regulations. Thank you.
Okay, thank you.
My name is John Awuni. I represent Kesben. When the 14 days quarantine was in place, Ghanaian evacuees who came from the Gulf region and even in the US had their tests taken. It took, after 14 days of the quarantine, they went back to their homes. They didn't get the results because of the faulty nature of the machines at the time. With this $100,000 equipment that is in place for the airport testing, I just want... somebody from the US came after 14 days, his test was taken, he never got his results, he went back, and what they told him at the time was that the machines, the results were not available. After a month, he was still going to get the results and he never got it. So now that this $100,000 machine is in place at the airport, what's the guarantee that there wouldn't be any issues regarding maybe the faulty or some mishaps in the machine and the results will not be available on time for the arriving Ghanaians?
Yeah, I think so too.
This was somebody who came from the US who mentioned to us. The equipment.
Anyways, colleagues.
No, when the man from Noguchi was talking, he said the kits is about $100,000. All right, maybe I didn't hear him well, but yeah, I didn't hear him well, but I heard something like that. So all the same, I wanted to know if, in case the machines develop some mishaps, what becomes of those who arrive, and then do we have enough of those machines to carry out the test without any problem?
Okay.
Thank you.
So Professor Mpovo, if you may, I think that the essence of the question is assurances about reliability of the machine, if you may. And let me encourage colleagues, please let's pay attention to the issues that are raised on the platform, especially if we want to refer to them as our background. It's important that we pay attention. Clearly, my brother missed a few of the points that were made. And so, Prof, please take up this matter and address it quickly. I believe that will be the last set of questions.
Thank you very much, Minister. Actually, when I was sitting there, I was reflecting that maybe I should have been more explicit. So I welcome the question. I did not say that the equipment at the airport is $100,000. Correction. I said that PCR equipment that we use, if you want to set up PCR equipment in a series to even do such testing for a number of people, say 100 people, within 2 or 3 hours, that would be the minimum cost of equipment that you would be looking at to be able to process, say, 100 people, even in 3 hours. So let me make it clear. The operation at the airport is time-bound. As you just said, a passenger comes, he gets his test done, and then he goes out, and we want to minimize the waiting time. So the equipment is a fluorescent immunoassay machine that processes 6 samples within 15 minutes. There are 2 banks of equipment that have been set up. Each bank is 40 machines. So the service provider has set up 80 machines at the airport to ensure that as passengers are arriving, they are being processed and their results are transmitted to the Port Health for a smooth processing of these passengers. I hope you've understood the point clearly now. I did not say that the equipment is $100,000. I was saying that PCR equipment that we use is in the region of that amount if you are even going to do 100 samples within 3 hours. That is just the equipment cost. Now, I did say also that we will be providing a quality control and quality assurance process, protocol, to ensure that the testing that is done at the airport. Now, the passengers are paying for the testing, so I think they will ensure that they get their test before they exit the airport. And this testing is in lieu of mandatory 14 days quarantine. So it is important that we actually process the passengers and they get their results, which should be in line with a negative PCR that they embark the journey upon. So it's to confirm that they are indeed PCR negative and they exit the airport with their results. That is the system that has been established. I think I've addressed the issue sufficiently. Thank you.
Thank you very much. Dr. Patrick Abuaji, there was a question that related to whether or not we are in contravention with some international regulation, but I had listened to the part of the same convention that the statement made reference to, and I thought that it was self-explanatory, and that the position that was adopted was rather in contradiction to what was said. But I don't know, Doc, you can address it. And sir, you said that the statement was issued by the Bureau of Public Safety. It's a civil society group. Okay. All right.
All right. Thank you very much. I don't know of any such regulation in the IHR, but even in that, we know that you are not supposed to provide any form of inconvenience, but we are not in normal times. There are countries that are even ban people from entering. There are places where, there are many countries where testing is done. We've gone through Ebola, we've gone through all manner of processes in our world. So the ultimate responsibility for us is to make sure that we protect every Ghanaian who is coming here. And even if a person is positive, it also provides an opportunity to provide management and care for that. But we have really not in contravention of any IHR regulations. And we are very mindful of that. So thank you very much.
Thank you very much. And please, again, let us also refer to the fact that even in the argumentations around cost of the tests that we are conducting, people are quick to make reference to tests that are being conducted elsewhere. So that is some background. And I also just, your phone is off, I would have read from your own statement to you, but I think that Doctor has appreciated the matter properly and he should lay the matter to rest. Colleagues, are there any other questions? If you may just expedite on it quickly, you can ask from there, sir.
I want you to clarify, how long will this engagement with the CSO regarding the country, how long will it take for government to decide on it?
No, I mean, government is always prepared to engage with anybody who wants engagement. If you want information, we are prepared to engage and provide the information. We are operating a transparent administration, and we do not shy away from sharing information. As and when anybody wants information, we are too happy to share the information with the person.
Was the engagement successful?
It was very successful. It's my understanding that a lot of positions have changed. Clarity has been brought to bear, and I've listened to some same civil society players who used to describe the deal in very negative terms, now describe it as good deals and in a positive light.
The concern for some people is that some close associates or relatives of the brothers of power, so to speak, have been given some juicy positions and they are not happy with it. And then they also say that the whole thing is going to be done on some secret island somewhere that nobody can have access to.
Well, I think that we do not have to waste too much time on the unfounded suspicions of people. Those are suspicions that are not grounded on any meaningful basis, and we should not pay too much attention to those ones. On the issue of those who are working or will work with EJAPA, you can rest assured that only people who are duly qualified and who have the necessary competencies to work with the deal will be employed to do that. And that international recruitment firms have been engaged to recruit the people who work with the deal. Any last questions, sir?
Okay.
Abednego, and unfortunately my tree has gone on holidays this morning, I beg you. And we can take it later on. It's a technical matter. There are words in the deal that I am yet to process into Chi. My L1, you know, is Ewe. I'm an Ewe. I'm from the Volta region. If Honorable Kojo was here, I'm sure he would have dealt with it. I need some coaching on that one. I thank you. So, colleagues, thank you very much, and we call it a day.
So there you have it, government's briefing on COVID-19, especially with regards to mandatory tests at the Kotoka International Airport for passengers arriving.